Welcome to In Her Words, Working Conversations by Women. I'm your host, Thando Mazibuko. Today, we're talking about truth that demands attention. Black mothers deserve care that sees them, saves them, and celebrates them. We've heard the stories of countless celebrities being dismissed during childbirth, only to be disbelieved or ignored about the pain that they're going through. But what about the women without the power of celebrity? The mothers whose voices don't make headlines, whose pain is met with silence, whose concerns are minimized, whose lives are treated as less urgent. This is why the work of our guest today matters so deeply. Ciara Lyons-Ragains is a nurse, a mother, a founder of the Black Maternal Table, a community of Black mothers from preconception to age 5, through advocacy, anti-racist nursing education, and radical community building. Ciara is building what saves us, one mother, one family, one system at a time. If you've ever felt unseen in healthcare, exhausted by inequity, or ready to be part of the solution, this conversation is for you. Hi, Ciara. Welcome to In Her Words.
Hi, thank you. Thank you so much for having me. I appreciate it.
Thank you. You wear many hats, one being a mother, a maternal advocate, a founder. What first moved you to bring these roles together, and who did you have in mind when you started your work?
I think all my life I've kind of been a person who's like, I want people to have justice, whatever kind of, whatever situation it is. I think things should be fair and people should have justice, right? As fair as they can be, right? Everything can't always be perfect, but as fair as they can be. So I would say from childhood, I've always had that. I also am the eldest daughter, so maybe that's a thing too. And a Capricorn, so maybe that's a thing too. But I would say that my own experiences are what brought me here, brought me to create Her Black Wellness, brought me to wanting to give a voice to those who either don't have one or they just haven't figured out how to use it, basically. They don't know the ways to go about that. And so one of my experiences was of my own. I'm a nurse, so I have experience from being at the bedside in different populations, from cardiovascular health to labor and delivery, maternal health, and now currently as a case manager in a lower socioeconomic community. And then also from my own experiences of having a child, from having an ectopic pregnancy that ruptured and causing me to have emergency surgery and being mismanaged medically through that situation, and knowing that that's happening to me. And it was happening at the hospital I worked for and at the time. And then after that situation, kind of having other losses, miscarriages and stuff, then going through IVF, and then not really knowing anyone personally who had gone through IVF with my family or friends. And so kind of navigating that by myself with my husband. So all of those things that I've experienced thus far have brought me here to want to help others kind of navigate it and know that they're not alone, basically. Yeah.
Thank you for doing so, and I'm sorry about your losses. And thank you for using your pain to be a driver of sense of purpose to help others. You have your own slogan, building what saves us. What does building what saves us mean, and your organization to you?
So I say building what saves us is because as it is now, the healthcare system, society in general, was not made for Black women, the Black diaspora, in general. And the way it's set up really doesn't work for us. It's not beneficial for us. So I'm like, we need to start from the beginning and we have to build what works for us so we can, thrive, so we can live, so we can be healthy, so we can pass those things down to our children. So I think that's where I came with that. Like we have to build it for ourselves. No one else is going to do it for us, basically.
That's true. You're a nurse with a master's degree and also a mother. Was there a moment in your clinical work and in your own pregnancy? I know you touched on your miscarriages and your ectopic pregnancy, or in your community work where you realize that the system wasn't designed for us? I mean, I guess your own experience, obviously.
Yeah. I mean, I kind of already knew that going in before I became a nurse. I've been a nurse for about almost 15 years now, in different units and capacities. But I always knew that we were kind of, like, it wasn't made for us, basically. And I always had the heart to want to amplify the voices of my patients. Um, so yeah, I wanted to do that already. Then being a nurse and working, and then going back to get my master's degree, I was actually going back to become a nurse practitioner. Mm-hmm. But during that time was also at the same time I was having my ectopic pregnancy and my miscarriages and things like that, and was working nights. So a lot of things happening, and I was very overwhelmed. So I ended up not becoming a nurse practitioner, but I did want to finish my degree. So I do have my master's in nursing, and going through that program was just like seeing outside of the bedside, right? Like seeing what nursing could be away from just providing the care like at the bedside, but how I could provide care and knowledge and advocacy from an education standpoint, from a C-suite standpoint, like from the corporate side of the business, basically, and not just at the bedside. Because as we know, most things don't change unless you're in power, right? Or unless you are in leadership and things like that. That's when you're heard. And so going through all of that and then becoming a mother, and being a mother literally just like radicalized me even more so, I would like to say, because I'm like, I had this little girl, and now I'm just like, ooh, I'm always trying to fight the powers that be, she gave me that. So I think all of that just kind of pushed me even more so into the sense of like, this needs to happen. We have to change. Yeah.
Her Black Wellness is a community of Black mothers that you built. What does community mean in this context, and how is it different from the traditional support groups or clinical care?
So the community, I would say, is more so like being able to be in sisterhood first and foremost. And I know like a lot of marketing and a lot of different groups say the same thing, but my idea is from like how you would be with your mother or your sister, like your siblings, cousins or aunties, grandmothers. Like in my mind, that is what community is. Having others who identify with your struggles, but who are also nurturing you and supporting you. And it's kind of like a give and take, right? Like the family supports each other, basically. And that's kind of a background I came from. My family's very close, and aunties, moms, sisters, everybody we're all living this life together. And so that is my vision for the Black maternal table, matriarchs table, and all of my communities, is that we are really trying to live a better life together and supporting each other through that, however that may look. And I think that we all really need that, especially today with what's going on in the world, and everything. I feel like we feel more alone than we ever have, even though we have more ways to connect, right? So community to me is that, like, really walking life with other people who understand your journey. Yeah.
You kind of touched on people feeling unheard in these times that we have so many ways to connect, but a lot of women feel isolated. So what would Black women who are listening, who feel isolated, unheard, and exhausted by these systems, what is one invitation you'd extend to her today?
I'd be like, come over, girl. Come be with us. Bring your stories. I think another thing is that we are afraid to show up as who we are, right? Because of whatever has happened to us, from society into our own, like, households and backyards and stuff like that, things that we've experienced. We were told that we weren't enough, right? We were told that our minds, our bodies, everything about us is not enough. And I'm just like, please come as you are. I would rather you show up your whole self authentically than you bring this facade with you, because I'm like, we can't really get down to the nitty gritty. Like, you can't really touch your spirit, right, if you're pretending to be someone else. And I want for all women, but especially for Black women, because it is so hard for us to just be able to say, like, this is who I am, and I am perfect in God's image, just like this, and I am flawed, and that is okay, like, because no one is perfect, and we shouldn't have to be trying to walk this earth that way. So my invitation is to come and be as you are. Tell us your story. Share about your children, your family, your own story, your own personal story outside of those other identities that you hold. How you honestly feel. Like, girl, I'm struggling today. Like, I'm tired. I'm whatever. I don't feel like putting my makeup on. I don't feel like whatever it is. Feel free to be that, say that, bring your expertise, bring the things that you want to talk about, and we can all kind of, like, vibe off of each other and share and help each other. Like, oh, well, I've been through this and this is what I did, or whatever, without feeling judged or, like we have to know everything and have it together. Yeah.
You also educate nurses through Antiracist Nurse Collective. What does anti-racist nursing practice look like in maternal care, and why is it a non-negotiable? I mean, we know why it's a non-negotiable, because really, we're human too. I don't know why I said that, but we're human too.
Well, because as we all know, we hear the statistics still. If anything, I feel like they're getting worse and not better, which is crazy because of the fact that we have all this technology and we have all this knowledge now. But again, it also doesn't necessarily have to do with that. And, coming from my background, and like I said, just kind of now that I am a case manager, I'm not necessarily at the bedside. I can also see from a bigger, like, view of the care that's being provided. And just seeing how, like, our bias and our backgrounds lead to judging folks while we're providing care. Some of us don't even realize that it's happening. Because I know plenty of people who are like, oh, I'm racist, or I'm not this, or I'm not that. But they don't even realize that certain, like some of the things that are just indoctrinated in them is from what they learned from racist caricatures, from discrimination, prejudice, things that were told to them. And so they don't even recognize sometimes, not all, but sometimes they don't even recognize that the things that they're doing or the behavior that they're showing could be discriminatory or racist. And then also not just for like racist against Black people, but like discrimination against people who have substance abuse issues or who are disabled, things like that, or people who are overweight, overweight in the sense that they think that is not right, right? Assuming that because people are overweight that they're unhealthy just because of the way they look, right? We all know that there's discrimination and stuff like that around that. And I feel like, especially for Black people, we get that a lot within healthcare. It's like, oh, you're overweight, so this is why this must be happening to you. And they don't even go and check anything else, right? It's just like lose weight. This recently.
Diabetes, so lose weight.
Right. And so, and I'm sitting here, I was like, I know plenty of people who are slim or skinny or whatever, who also have these certain health conditions and things like that. So it's not just about weight, right? We have to learn to look past the things that we see and the things that we were told, which is discriminatory in the grand scheme, to be able to provide equitable care. And at the end of the day, that's what we're trying to do. We want people to be healthy, and we want people to live healthy, and feel comfortable coming to the healthcare community and seeking help so they can do those things. And so that's really what Anti-Racist Nurse Collective is. Bias Rounds is basically workshops for healthcare providers as well within the corporate setting of just like, let's talk about the bias that we have. Let's identify them. And then how do we change them in real time, in the real world? So, yeah. Yeah.
Well, allies, partners, family members, policymakers as well, because I think policy is the biggest one here, who want to support your causes. How does that look like, and what does it look like in action to support the work that you do?
Tell others about the work that I do, pass it on. That is the best way to help in that way. And then also, like, if you are in leadership in hospitals, like I said, I am very much like, I want to do workshops with you and your team, hold education within like the units of the hospital, individual nurses or healthcare providers in general, reach out to me, email me. We can talk through what is going on with you. I can help you like set up scripts to like, use when you need to advocate, or to help you talk with your patients if you feel like you don't know how to do that. And then also, talk amongst yourselves about what is going on, what you see. Again, I think we live in a world now, like you can't tell me that you don't know what's happening, you don't see what's happening in the world going on around you. Because if you do say that, I'm going to be like, why? Right. Like, where you been? Exactly. You've been under a rock. Like,
we all saw that mom on TikTok who was discriminated against. We all saw it. And I'm
right, exactly.
Across the world.
Right, exactly. So I'm just like, start really holding the conversation, start holding people accountable. And it doesn't have to be in like a rude way or anything like that. You don't have to be angry when you do it, but, press people. Be like, well, why would you say this? Or why would you think this about this person? I am notorious to be like, well, why would that be the situation? Why would you think that? I will ask that question real fast, because I'm not to be mean, but I'm like,
why?
I'm trying to understand.
Why do you think like that?
Right. What is the thought? And then maybe you know something that I don't know. And so I'm like, okay, then why was this? And I will why you to death until I'm like, oh, okay, that makes sense. Or it don't make sense. And I'm like, it don't make sense.
That's true. I'm
So
also
you got to think about that, right? You got to go back to the beginning to figure it out. But yeah, I just think that people spreading the word, and even like, even reaching out to me if you want to kind of start this topic, these discussions, having these roundtables, things like that, in your area, where you are, in your, it doesn't have to just be healthcare. It could be any sector that you work in or that you're involved in. And I would love to help kind of get those conversations started. And it's because we can no longer hide. We can no longer be like, this is not important, as we are seeing in the world today. Yeah.
If people are looking to connect with you, where can they find you? I know you're on a few different platforms.
I am on a few.
I'll link all of them.
Am I doing them right? That remains to be seen.
What is right in that context? What is right? You are showing up. It doesn't. You are showing up as best as you can, authentically. What is right?
I am no marketer. I would be happy if I was. But I am on Threads. I really love Threads. There's a lot of keying. That right, exactly. There's a lot of keying there, so some fun. And then I also find people like you, and we all just kind of get to chat about what's going on in our lives and around the world. So Threads, definitely. Feel free to slide into my DMs. I'm on Instagram. All of them are Her Black Wellness. And then I'm also on LinkedIn under Ciara Lyons-Ragains. I also have a Substack now that recently started, where I'm kind of just, sharing stories around experiences that I've had, my own experiences, experiences that I've had as a nurse, and things that I see as a nurse, and then also a family and friends experience that are okay with kind of letting me tell their stories and mixing it with how it affects us today, and how it coincides with healthcare. I recently just talked about, on Sunday, I just posted about my friend having high blood pressure, preeclampsia while she was pregnant, and then how the lack of communication could have led to poor outcomes. Thankfully, it didn't. But, just how we need to do better as healthcare providers in our communication to our patients. So yeah, I can share the link with my Substack. It's called They Weren't Listening. And then those are the main places that I'm at, basically. And then also you can email me. Yeah.
Are you sure? I like it. Let's find you on social media first.
Okay. Find me on social media first.
I will link everything. You have to be safe, girl.
True. You're right. Because sometimes people be crazy, It's true. See, guys, I needed her because I'm like, listen, we can chat it up. But you're right. People be crazy.
There has to be a few barriers before you get there. No,
let's chat over there. Right.
Chat over there. Then maybe if you're all right, you can go personally to your email. No.
Exactly.
No, Ciara, no. And my final question to you, if you could leave our listeners with one blessing, an affirmation, or a call to action as they move through this week, what would it be?
I would say it would be, on my newsletter, I like to end, and in my Substack, I like to end with, and until next time, you are the best thing. Because we are, to ourselves, in our communities, we are the best thing. And I think we forget about that. I think we forget with everything that's going on around us, again, with all the identities that we have to show up as, that we forget that we as ourselves, just as we are the best things. And I would love for everyone to kind of take that with them until next time. You are the best thing. Continue to show up as you are. Continue to tell your story. They matter. And know that you will be okay. Yeah.
And thank you for that. Thank you, Ciara, for joining us today. And thank you for the work that you do. It's so important, and using your voice and your qualifications in a way that is creating such a big impact. I appreciate it.
Thank you so much. I appreciate you. Thank you for having me. And I'm looking forward to anything and all the comments that people share with us and letting us know about their lives too. Please do.
Thank you.